Hi, I'm Dr. Lane Smith. Welcome to the Plastic Surgery Channel.
Hi, I'm Dr. Bill Adams, and welcome to the Plastic Surgery Channel's newest show, PSC Hot Topics, where the channel's experts weigh in on current hot topics in plastic surgery and help you cut through the hype and myths in plastic surgery. With me today via webcam is Dr. James Namnoon. Jim, great to have you with us.
Great to be here, Bill.
So there was a recent article that just came out in the New York Times last week, and it was about awake breast augmentation, where breast augmentation is performed with the patient not under anesthesia, or I should say under local anesthesia. And I wanted to get your thoughts about that for the next minute or so. So tell us a little bit about that. The thinking is that, at least what's been professed, is that this is a safer way to do breast augmentation. Give us your thoughts.
Well, I think that the question is, what is safety? And we all know that most breast augmentation is done very safely, obviously, and effectively under general anesthesia. This is breast surgery that's done by quite experienced surgeons. Yeah, as we know, the risk of general anesthesia in a healthy patient is significantly less than the risk of driving to the grocery store. So I think the first idea or concept that it's somehow safer to do it under local is really probably false. Secondly, I'd say that surgery under local anesthesia is, if anything, much more difficult than surgery under general anesthesia, and consequently, one would want an extremely experienced surgeon to consider, if one was going to consider doing surgery under local anesthesia, as their surgeon. Unfortunately, the article contends that with basically a weekend course, perhaps over soft drinks, and in a 30-minute teaching seminar, one can learn everything you need to know to do this kind of surgery under local anesthesia. So I think safety is really not what's paramount for these doctors, and certainly not in the best interest of the patients.
So what about what's been touted as an advantage of this technique is that patients, because they're awake, can actually participate in selecting the size of their breast implant. Is that realistic?
Well, you know, Bill, it's a great idea. Unfortunately, it's not very realistic. I mean, the patients have to be sedated using the same kind of drug, I'm sure, that Michael Jackson got to help him go to sleep during the regular nights. And that drug is, if anything, a profoundly sedating medicine. So as a consequence, the patients really can't play any role in making any decisions about their surgery because they're not going to be able to remember any of it. So it's hard to imagine that someone who's that quote-unquote drugged can really play a rational, make a rational decision about the size or shape of their implants. So I think that's really not correct. That assumption is really not true at all.
And lastly, just do you feel, is this a good concept for patients?
No, not at all. You know, frankly, patients really don't know beyond a certain level what's safe and effective for them to help them get the best result. We certainly like to involve them in the decision making, but you know, careful planning and precise execution are the keys to avoiding reoperation in breast augmentation. As we all know, even in the best hands, the reoperative rate is anywhere from 20 to 30% at 6 years. So as a consequence, these are operations that are not to be considered as trivial operations. Doing them well requires a lot of planning and really excellent operative execution, not something to be done casually.
I think those are really great words of advice, and certainly going to a board-certified plastic surgeon would be the first step in somebody considering a breast augmentation. I want to switch gears with you, Jim, here to talk about something that we get emails about nearly every day on the Plastic Surgery Channel about mommy makeovers. What is a mommy makeover?
Well, a mommy makeover is really a group of procedures that are done to help women deal with the aftermaths of having children. You know, women have sacrificed their bodies, their femininity, their sleep, and many other things, all so they can have children and take good care of them. And mommy makeovers then are designed to restore them to really a state before they had babies as best possible. And no one expects that they can be all the way turned back into a 17-year-old after they've had a few children. But essentially, there are operations that are designed around making a woman feel like she looks good again, and putting back energy into her own femininity so that she can continue to perform for others. So what does that mean? It usually means dealing with saggy or droopy breasts. Sometimes these breasts have lost their volume. Often they've lost there's excess skin and they've lost structural support, so it's enlarging and or lifting the breasts and making them more shapely. And it's dealing with the relaxation of the abdominal tissues and the redundant skin and the extra skin over the lower abdomen to try and shape it and make it more beautiful, and really deal with other issues such as the scarring that could have occurred after a C-section, the characteristic overhang right above the right above the pant line that can be so disconcerting to women. Is dealing with all these things to give them a tailored, shapely-looking abdomen, perhaps a little bit more shapely-looking hips, a little slightly fuller buttock, and of course lifted, fuller, and more beautiful breasts.
And I would imagine that the women that you see for this type of procedure must really have significant impact on their quality of life.
Oh, I think so, Bill. I mean, I think that, too often we lose sight of the fact that these women have been giving up everything for perhaps a 10-year period of time, for children, for husbands, sacrificing their careers, their bodies, etc. And they need to have something. They need to be putting some energy back into themselves so that they can continue to go on and sacrifice for everyone just the way they want to. So I think it really gives them a much more of a sense of wellness, so they can go out to and continue to do all the things they do for everybody else.
Well, Jim, I really appreciate you taking the time out of the day to talk with us. Your insights have been invaluable. I'm sure our viewers will appreciate everything you've talked to us about today.
Oh, great, Bill. It's so good to be here, and I'm happy to help at any time.
So thank you for joining us on PSC Hot Topics. Stay tuned for our next PSC Hot Topics. Will be coming later this week. And if you have any hot topics in mind that you'd like us to cover, make sure to email them to us here at info@theplasticsurgerychannel.com. Until then, we'll see you next time.
Hi, I'm Dr. Lane Smith. Welcome to the Plastic Surgery Channel.